In this voiceover, we're going to talk about urinary tract calculi and polycystic kidney disease. Urinary tract calculi are also known as kidney stones, and there are many factors that play into the formation of these stones. The crystals from our urine can cluster together, causing the stones to form. The key is to prevent dehydration and help maintain the flow of urine. This will help decrease the risk of developing a stone. Bacteria from a urinary tract infection can also cause stones. As I mentioned on the first slide, there are a lot of different causes of stone formation. There's not one single etiology that accounts for stone formation in all cases. Factors can be either climatic, dietary, genetic, metabolic, or lifestyle related. The first symptom of a kidney stone is usually sudden, severe, sharp pain that is felt in the back, lower abdomen, or flank areas. Renal colic is the term that we use to describe the pain that is felt resulting from the stretching, dilating, and spasm of the ureter in response to an obstructing stone. People who have renal colic have a really hard time sitting still, so they may go from walking to sitting to lying down, and then they repeat this process because they just can't get comfortable. People call this the kidney stone dance. Men may experience testicular pain, and women may experience labial pain. Both men and women will have pain in the groin area. The patient may have other signs and symptoms of a UTI that include dysuria, fever, and chills. When caring for a patient with kidney stones, we want to make sure that their pain is under control. In most cases, opioids are used to help control the pain. Most stones will pass spontaneously on their own, but it can take up to 2 weeks. Sometimes patients are prescribed Flomax, which is a smooth muscle relaxant that can help them pass the stone. A few reasons surgical intervention may be necessary are the size of the stone, so if it's too big to pass, if the stone is associated with infection or bacteria, if it's causing impaired renal function like elevated BUN or creatinine, if the patient is having persistent pain, nausea, or vomiting, if medical treatment is not working, and or if the patient only has one kidney. In these situations, surgical intervention like a lithotripsy may be indicated. We want to teach the patient to try to deal with the kidney stone and how to prevent reoccurrence. So a low sodium diet is recommended. We should teach the dosing schedule and potential side effects of the drugs that are used to reduce the risk of stone formation. Some patients will be taught to self-monitor their urinary pH, or they may be asked to monitor their urinary output. So we need to make sure that we're teaching them how to do these things. Pain management and patient comfort are the primary nursing responsibilities. We need to ensure that any spontaneously passed stones are retrieved, so we'll be straining all urine using a specific urine strainer. And we need to encourage ambulation to promote movement of the stone from the upper to lower urinary tract so that it passes. In the second half of this voiceover, we're going to talk about polycystic kidney disease, which is also known as PKD. Polycystic kidney disease is one of the most common genetic disorders in the world. It's a progressive disease that causes excessive growth of fluid-filled cysts within the kidneys, and it's a common cause of end-stage renal disease. Generally, with early stages of polycystic kidney disease, there are going to be no signs or symptoms. When symptoms do appear, it's because the cysts are growing larger and they start to put pressure on surrounding organs and start to damage the kidney tissue. One of the first symptoms you'll see is hypertension. You'll also see hematuria because as the cysts begin to rupture, that blood drains in our urine. You'll see flank pain at the level of the kidneys, increased abdominal girth, and that's because the kidneys are growing so large. With severe polycystic kidney disease, we've had patients with 15 to 20 pound kidneys taken out because the cysts have grown so large and made the kidneys so big that they've had to be removed. UTIs can also be seen in these patients. The diagnosis of polycystic kidney disease is generally made off of those signs and symptoms. Along with those symptoms, we can perform an MRI, CT scan, or renal ultrasound. With all of these imaging tests, we'll be able to see the cysts within the kidneys. When treating polycystic kidney disease, we start off by treating the symptoms. We'll bring down their blood pressure using ACEs or ARBs. We'll treat their pain using narcotics. As the disease progresses, it may lead to end-stage renal disease. If it does, the patient may need to be on hemodialysis or peritoneal dialysis. If the kidneys grow too large, the patient may need a nephrectomy, which means the kidney needs to be removed. This can happen to either kidney or both, depending on which is affected. Nephrectomies are incredibly painful surgeries, so the patient will be on a PCA pump when they come out of the operating room. If the polycystic kidney disease leads to end-stage renal disease, and the end-stage renal disease gets too severe, these patients may receive a renal transplant, which will help get them off of dialysis.